Hi everyone, my name's Andy McGowan. I'm the Head of Carer Services at Caring Together. Today I'm going to be doing a bit of a talk around the subject of carers and how the Covid-19 pandemic has affected them and their families. So in terms of what they've been saying, but also what support's available. Some of you may have seen the previous talk that I did on young carers. So this talk's focus is going to be very much on adult carers. So those over 18, irrespective of who they actually care for. So it could be their husband, their wife, it could be a son or daughter, it could be an elderly parent, it could be any of those. So over the next 20 to 30 minutes or so, I'm going to be covering a bit of a controversial question, provocative question, deliberately to kick us off with actually, has the caring role been forgotten during lockdown? And I'll explain why I've put that question in a short while. I'll then go on to talk a little bit about how the pandemic's affecting carers. So in terms of what we've been finding in the area where we work, which is Cambridgeshire, Peterborough and Norfolk, but also what findings have shown from other studies, so Carers UK and other organisations who've been looking at how COVID-19 has had an impact for carers and their families and what challenges they faced. But I'm not going to talk just about statistics, I'm not going to talk just about numbers. What I'm thinking will be most of use, and I'm hoping will be of most of use to carers out there, is actually knowing what supports are available. So things to think about in terms of if you're a carer yourself, or in terms of you have someone in your family who cares for you even. What support is out there? Where can you turn to get that information, get that advice? And so towards the end of this talk, I'll be including some useful websites and some useful organisations so that you can check in terms of them out to see whether they might be of any use for you. And if you are going through this and you want to find out a bit more or ask me about anything I've said, or even if you want to challenge anything I've said, you can either leave as a comment beneath the video, or you can email me, and my email address will be on the final slide as well. So hopefully this will be of use and interest, and I'm really keen to hear from carers if you have any feedback. So as I mentioned, I'm going to start with this slightly provocative question, and it's being deliberate. I'm not just feeling provocative this morning, but this is because this is what carers have been saying to us. So I talked about it last time in my talk around young carers, and we've heard exactly the same from adult carers as well. The fact that actually when you're looking at the media, when you're looking at research, when you're looking at what was out in the sort of guidance, actually it's taken quite a while for carers to be on the radar. And also we've seen some of the rules that are in place for local authorities around supporting carers and supporting those with care needs. And they've been relaxed during the COVID pandemic, and that's had a big impact on carers. And so those of you who saw my Young Carers talk would have heard about the young person who said, actually, the clapping for carers on a Thursday, that was something that actually made them feel, to start with, that the carers were being hugely forgotten, because it focused first on paid NHS workers, then it went on to paid social care staff, so those working in care homes, those delivering care to people in their own homes. And what carers were saying, and we've heard this through our virtual groups with carers, we've heard it from speaking to carers on the phone lines, we've had it from carers who've been emailing us at 2-3 o'clock in the morning, just crying out for support, that they really do feel quite invisible. And I think we've done a lot of work at Caring Together to raise the profile of carers. Carers UK and Carers Trust have done a lot of work as well. But it is still more to be done to make sure that people aren't forgetting that if they're doing a shopping trip for their next door neighbour, if they're collecting a prescription, that actually this may well be because there's a carer in that household who needs that support. So I think over the next few months, it's going to be really, really important to make sure that we are thinking about carers. And if you're a carer watching this, not being afraid to speak out and to remind people that carers need to be on the radar. They need to be on everyone's radar because they're everyone's business as far as I'm concerned. And so it's going to be hugely important as we approach the autumn and the winter months, which I'm recording this when it's 35 degrees outside, so it seems a lifetime away, but it will be here before we know it. And so it's really important to make sure that carers are identified and have support in place before we get into flu season or any potential risk of a second peak or anything like that as well. So what way has the COVID-19 pandemic affected carers? And I'm really interested if any of you want to leave comments or send messages into different strokes, or to email me at the end. If any of you want to share your experiences as to how the COVID-19 pandemic has affected you, for me, that's the most powerful message. I can talk about stats and figures and numbers, and I will do. I'll talk about that next. But actually, it makes such a difference hearing firsthand from carers. So that's why at Caring Together, we deliberately went out to carers really early on. So back in April, we did a survey, went out to carers of all ages, and we had about 200 responses, which for a snapshot and a sort of a local survey, we were really pleased with. And you can see the results on the screen here. That actually the COVID-19 pandemic has had a huge impact on the emotional well-being, and even the physical well-being of carers. So some of you watching this, if you've taken on caring roles during the pandemic, you might have had your caring role increased because potentially either the condition of the person you help care for has got worse. Actually, there will have been people, there's no may about it, there will have been people who've had strokes during lockdown, and so people have become carers overnight. But also there are a significant number of carers, and you can see that quote that I've put in at the bottom of the slide, who actually have chosen themselves not to have additional support coming in. And that's not because they're saying, we're fine, we don't need that support. Actually, what it is they're saying, we're concerned, we're scared, we're worried about bringing too many people into the house for risk of catching the virus or it being brought in. And I think that's a huge concern, because when you're used to having paid care workers coming in, paid support, potentially through the local authority or other companies, that can make a real difference for carers, because it gives them the chance to do those little things, to go and do the shopping, to go and do the garden, to go and actually prepare lunch for themselves, to actually have a bit of a time out for them. And so that, as you can see, a significant number of carers have been telling us throughout this lockdown that they just haven't been able to have a break. And that's something that we're really, really worried about. And so we've done a lot of work at Caring Together to help find ways, creative ways, where we can give carers a break, even if it's from the confines of their own home. But this isn't just something that's been shown up for us in Cambridgeshire, Peterborough and Norfolk. Carers UK, some of you watching may have heard of them, you may not have. If you haven't, I would suggest looking them up, because they've got some really good, useful information for adult carers in particular. And again, their website will be on the slides later on if you want a specific link. But they did a significant scale survey of carers, and they had thousands of responses to their survey, you'd expect as a national organisation, which really helps to give a bigger picture. But I think what you can see on here is actually a lot of the messages are consistent in terms of carers having to provide more care for the person they look after, carers feeling overwhelmed and feeling at risk of burnout. But also, one of the things I'm going to talk about in a short while in terms of support you might want to think about if you're a carer is actually, you see there, 87% of carers were worried, what happens if they have to self-isolate or if they become ill? Who will look after the person that they care for? Or what about if any other emergency happens? And that's something that I'm going to be talking about slightly later on, because for me and for us at Caring Together, planning ahead, thinking ahead in case of an emergency is crucial for carers. And actually, we found it can make a real difference having that peace of mind in place. So, as I said, you'll be glad to know I'm not just talking about statistics or numbers, particularly when it's so warm outside as well. So I'm going to be talking about what support's available in terms of, I'm going to be covering a bit about carers assessments. I've already mentioned about planning ahead, but I'm going to go into some more details. But then I also want to make sure that you know about what organisations might be able to help you or the person you care for or your family. You see, I've already put a phone number on here, so the Carers UK helpline. So if you are a carer, you're caring for someone at home and you think, I don't really know where to turn to, I need some information, I need some advice, As I mentioned, if you live in Cambridgeshire, Peterborough or Norfolk, then you can contact us at Caring Together. But Carers UK is a national helpline, and the opening hours have been extended during the COVID pandemic, thanks to funding from the government around this one. And they've also got an email address there that you can contact. But just to kick off in terms of carers assessments, so adult carers are able to get an assessment under the Care Act. But one of the things we've seen in terms of during this pandemic is actually some of the rules around carers assessments have been eased so that local authorities can focus on the direct response to COVID. And I think the key thing I want to say is to contact your local authority to find out what the situation is. Because even if your local authority was stopping carers assessments or weren't doing reviews of carers assessments, what we found in our local area is those where potentially things had stopped, they're now starting to come back online. And in some other areas, for example, if we look at in terms of Cambridgeshire and in terms of Peterborough and Norfolk, they didn't stop at all. So carers were concerned that carers assessments weren't happening or they couldn't get one. But actually, if they contacted the local authority, they'd soon find out, yes, actually, they can. Yes, in terms of how they're being done, it's completely different. So rather than doing face-to-face, potentially, they're being done much more over the phone. But those carers assessments are available. And for me, this is often your starting point in terms of actually, this is a legal right for carers to get that assessment, to actually look at what their needs are, to actually make sure that they get the support they need to be able to continue caring, and that actually their health and well-being shouldn't be negatively affected by their caring responsibilities. And so this responsibility sits with the local authority. In some of your areas, it might be done by a carers organisation on behalf of the local authority, so on behalf of the council. But ultimately, if you go to your local council, so for us, it's our county council or our city council, they'll be able to point you in the right direction of where the latest information is around carers assessments. So you might be wondering, as we get onto this slide, why has Andy got a picture of some cars and about car insurance and a calculator? What's that got to do with carers? What's the relevance? And I just want to reassure people, my 2-year-old hasn't been playing with my laptop. He hasn't changed the picture. I wouldn't be surprised if he was able to, the amount he uses technology. But the reason that's on there is because actually, if we think about why we get car insurance, if you have a car, if we think about why we get contents insurance, home insurance, life insurance, even medical insurance, there's a whole raft of different insurance policies that we take out. And why do we do that? If you're like me, you definitely don't take out insurance because you want to take it out or because you want to pay a proportion of your income each month to go to insurance. It's not because I'm necessarily expecting anything to happen. I don't have car insurance because I'm expecting to go out to the shops today and something happen. But the reason I have it is that actually if something does happen, if I have an accident in my car, if the washing machine packs up, if I have a flood in the house, any of these sorts of things, actually I've got that peace of mind knowing that there's a plan in place already, knowing that actually should there be an emergency, should there be something that needs sorting, I'm not having to try and scramble around and get everything in place and try and find the full resource that's needed when that emergency is happening. Actually, those plans are already there. They're already laid out. It's really clear. I know what to do. My family know what to do. And that's exactly the point we want to get to for all carers. That actually, by thinking about what if something happens to you, what if something happens to the person you care for, by thinking about those in advance, when actually you haven't got the adrenaline and the rush and the time pressure of an emergency. So how does that work in practice? So the sorts of examples are, so we have in Cambridgeshire and Peterborough a what if scheme. And the what if scheme enables us to provide support to adult carers when something happens in an emergency, which means they can't continue providing that care themselves. So that sounds great as a scheme, that sounds great talking about it in theory, but what does that look like in practice? So in practice, we've had carers throughout lockdown where we've had a call at 2 o'clock in the morning from the ambulance crew. So they've got a carer who needs rushing into hospital because of their own physical health. And that leaves the person they care for at home. And so rather than the person with care needs at home having to go into hospital as well, which we all know we're trying to restrict the numbers of people in hospitals at the moment for everybody's benefit, what that means is actually we can help to get that support in place. So it could be something as simple as phoning the next door neighbour, or phoning a relative in terms of another sibling, or in terms of another family member who lives in the town, in the village or nearby. It could be even someone who lives a few hours away but actually is in a position to help. So we help coordinate that. We do the phone calls, we bring the relevant people who've been nominated by the carer, so that actually the carer doesn't have to worry about that. They can focus on them. But it also means that if, for whatever reason, those nominated people can't help, so, okay, the person up in Liverpool can't get down for 4 or 5 hours, for example, or they're at work and they can't get away, and so it's going to take an hour or two before they can get there. What that means is that we can send in one of our care workers to go and provide that support until that support can get there, or until the carer can resume their caring responsibilities. And so we've had lots of examples like that during lockdown, where that peace of mind has really made a difference for carers. Because it might be they just need someone to be in there just for a few hours until the backup can arrive. But actually having that support in place really does make a big difference and give that peace of mind to carers. And again, this is something that is slightly different in each area. So if you contact either your local carers organisation or contact your local authority to find out what support they have in place around emergency planning, that would really be your starting point. But also it can encourage you and the person you care for to think about what happens if there was an emergency, and it doesn't have to be a medical one. So it might not seem relevant right now when it's blue skies and sunny outside when I'm filming this, but actually, what about if there's a power cut? What about if the electricity's gone off? And what difference does that make? It might be inconvenient for some of us in terms of the lights going off, and in terms of some other appliances not being able to watch TV and catch up with things, might not be able to get on the Wi-Fi, which can cause its own problems. But actually for carers where potentially they need medication stored in the fridge, for example, or in terms of actually if they need, in terms of electricity, because that's how it powers stair lifts or hoists, or in terms of the bed that helps them get up and get out of bed. When you're thinking about things like that, that can make a huge, huge difference and suddenly turn something that's an inconvenience into a massive emergency for carers. So what I'd really suggest is contact your local sort of utility suppliers, whether that be your water, whether that be your gas, your electrics, because actually what you'll find is lots of them have a priority list, or in terms of a vulnerable clients list, and various different schemes along those sorts of lines. So we've got them in our area as well. But what that means is, should the water go off, should the power go off, actually you'll be at the top of the list for making sure that they get in contact to make sure that you're doing okay, and for getting you back online and getting you back connected first. So that can be really reassuring to know actually that scheme's in place should these sorts of emergencies happen. But also, again, going back to medical situations, thinking about what happens if the person you care for has some sort of accident. What about if they have a fall? Are you able to lift them up? Is it safe for you to lift them? But just knowing some of those basics about what you do in that situation, or if they need to be rushed into hospital, do you have any list of medication available? Do you have the hospital bag available? All these sorts of practical tips. I hope for you watching this who are carers, I hope you never have to use that plan. I hope you never have to go and get that hospital bag, take that medication list. But I'd also much rather you have that in place and have that in position in case it does happen, because then it means anyone can do that. If you know where the hospital bag is, if you know where the medication list is, perfect. Next door neighbour can get that. The paramedic crew can get that. It just means that it's done and dusted and you don't have to worry about it. But it's not just about emergency advice and planning ahead. We're very aware that actually loneliness and isolation has been a huge issue for adult carers in particular during lockdown. So we've been doing lots of virtual groups, doing telephone support, doing information and advice over the phone as well. And that works for quite a few carers. And actually we've reached a lot more carers in that way than we did previously in terms of through telephone and digital. But also we know for lots of carers out there, actually digital doesn't work for them, or phone doesn't work for them. And so actually being able to access in terms of face-to-face support, that is really difficult at the moment, but things are starting to come back into the community. So we're just in the process of looking how we can use some of our volunteers to go and do socially distanced meetups in the garden, or go for a walk with carers, just to help give them that human contact and get them out of the house. Because loneliness and isolation can be a huge, huge issue for carers at the best of times, particularly at the moment. But also, you might be a carer who's trying to balance caring with employment. And so actually you might be currently furloughed at the moment, or you might have deliberately taken furlough or requested it because of you being shielding, for example. And so as that scheme starts to come to an end in the next couple of months, more and more of us who are in work will be looking to go back into work and needing to go back. And so if you need any information about how to balance caring with employment, what your rights are in employment, all these sorts of things, there's lots of advice and lots of useful guidance out there. So for adult carers and employment in particular, Carers UK have got lots of really useful resources. Carers Trust have got other information as well, particularly around sort of carers who aren't able to care anymore. So I'd really suggest checking out those two organisations. Obviously, this talk has been set up and is being hosted by Different Strokes. So they've got a lot of useful information and videos and things for carers at the moment. I've seen on their Facebook page lots of great content and exercises and ways to keep people active at the moment, which can really help promote the sort of well-being of carers. And also the Stroke Association, they've put together some specific resources aimed at carers around about getting support during this pandemic. And one of those links will be on the next slide that I go to. There is a government guidance out around carers. This came out a few months ago, so it is a little bit more dated now in the grand scheme of things, but it is out there. So if you think it might be useful, the link's on this slide as well. And so Different Strokes will make these slides available in case you want to look on it later. But it is worth saying, if you do want to look at it, just Google government COVID-19 guidance for carers and you'll find it. It's near the top of the list, so that's not a problem. So as I mentioned, I wanted to give some practical, not just names of organisations, but some specific websites. So I mentioned about the Stroke Association and their specific information around coronavirus. So that's the top link there. But also the second and third bullet point. So they are, Carers UK and then Carers Trust. As I mentioned, they're national organisations, but what they have, which is really helpful, is you can go onto both of their websites and you can type in what area you are, so whether it's your postcode or your town or city or village, and they'll tell you where your nearest support is and what the support is in your local area. So if you're looking for that phone number, looking for that email address, you might be watching this and realising, actually, my husband's had a stroke, I'm caring for him, or my son's had a stroke, I'm caring for him, or my daughter's had a stroke. So up until now, you might have been watching this and thinking, actually, I've been the mother of someone who's had a stroke. But actually, you might not have ever thought, actually, I'm a carer. And you may not have thought, well, actually, where do I start? Where do I start with getting information? And so unless you know where it is in your local area, Carers UK and Carers Trust can be a really good starting point. I mentioned earlier that loneliness and isolation have been a really big concern for carers. And so one of the websites that has come up and the sort of support offer for carers that's come up during this pandemic has been Mobilise. So I'd actually not heard of Mobilise before this pandemic. Being honest, I don't know if they were around before the pandemic. They may well have been, but they've come onto my radar specifically during lockdown. And so what Mobilise are doing is they've got lots of coffee and catch-ups or coffee and chat sessions. So the opportunity just for carers to have really informal get-togethers online. So using sort of video messaging platforms, just to be able to keep in touch with carers of all ages, but from across the country. They've also got blogs on their website. They've got useful sort of top tips as well. So if you're interested in that sort of video support and the virtual support, if your local carers organisation isn't doing that in the area, or if you just want some more of it, do check out Mobilise and see what they've got to offer. And everything I've seen on there, that there's no cost of it to carers as well, which is always an added bonus as well. And as I mentioned, Carers UK, as well as having that information to local support, they've also got specific coronavirus information and COVID-19 guidance and useful resources and useful tips and links for carers as well. So I would really suggest to have a look at those, because the great thing about websites is you can check it when you need to. If you're watching this at 3 o'clock in the morning, because that's actually when you're able to get some time for yourself. The good news is you don't have to wait till 9 to wait for a phone line to become available. Actually, there's a huge amount of information available online at the moment. So that's everything that I was wanting to cover today. I'm hoping it will have been of some use. It was just meant to give some top tips to remind carers actually they're not alone. It might seem that you're the only one in this situation at the moment, or actually you might feel I'm struggling to cope. But the reality is actually lots of carers out there are struggling to cope at the moment. And that's not saying it's okay. That's not saying that's how we want it to be. What we're really keen to say is, if you feel you are struggling, or you feel like you might need some information, advice, or even just someone to talk to, make sure to reach out. If I think of us at Caring Together, we're ready and primed to offer more support than ever to carers in Cambridge and Peterborough and Norfolk. And I know counterparts in other carers organisations across the country are exactly the same. There is probably more support than ever available right now. We think of telephone support, virtual support, practical support, things like supermarket letters, things like information on how to get priority shopping slots, in terms of information about going back to work. All of these sorts of things are out there, and you just need to know where to go to access them. So hopefully some of what I've covered today will help you to navigate that. If you do have any specific questions, my email address is here on the slides. So do feel free to get in touch with me. But also, if you just want to share your experiences, leave comments below to share your experiences. Share them with Different Strokes, because you can also contact them if you want to get hold of me. But also drop me a line, because I've been on numerous sort of radio and TV interviews talking all about carers, and it's always really good to have those real life examples to share and to make sure that we're talking about what's mattering to you right now. So thank you very much for watching. Wish you all the best, and take care.